Hello, I'm Joseph Saladino with Marrow Access Technologies, and I'm joined today by Dr. Jason Coe, Director and Chair of the Orthopaedic and Spine Institute at the NorthShore University Health System and Clinical Professor at the University of Chicago. Good afternoon, Dr. Coe.
Hi, Joseph. How are you?
Very good. I understand that you had one of the first cases using the SmartShot Marrow Access Device last week. Can you tell me about the patient's injury?
So this was a guy in his 30s. He runs, he plays soccer, and he was having a lot of patellofemoral pain and crepitus. His MRI showed that he had some cartilage damage on his patella, and I was concerned about full thickness defects. This is a tough lesion because cartilage defects in the patella are really hard to treat. The angle of approach to the undersurface is hard to get sometimes. The bone's really hard, and the patella moves when you try to drill or try to use an awl. So the SmartShot was really a perfect solution for this problem. So here we are, we're looking at the undersurface of the patella. You can see the lesion here, it's pretty small. It's maybe about 5 or 6 millimeters by 2 to 3 millimeters, but you can see it's starting to delaminate at the edges. And so we put the SmartShot in from this alternate portal. And you can see it's very easy to punch and make this little tiny needle hole in the really hard bone of the patella. And so we've got a couple of little holes there. There's another little full thickness defect over here. And then again, bang, just go ahead and fire the device. It makes a little needle hole there. You can see a little puncture hole. And then there's a couple of other little areas there. Again, fire the device, and then we'll get the ability for the pin to just easily extract. So you got these little needle holes. And I think the best part was to see that once we applied a little suction, took off the pressure, we got really great flow from a tough area. This is the patella. You can see how much bleeding we got right from those lesions once we got the SmartShot device to make the little marrow access holes.
Given your early success with the device, how will it fit into your treatment plan going forward?
Well, I think this is really perfect for any time you really want to do any sort of marrow access. I mean, this was a real ideal case. It's small lesions, but are full thickness. And I think one of the concerns is that if we didn't treat this, it was just going to get bigger and bigger. We know that these things tend to increase, like potholes in the winter. Obviously the SmartShot can make holes in really hard and tough bone, which is a difficult thing at times, and it's really precise. You saw how tiny the holes were. I think we're going to use it for small defects. I think marrow access is still the gold standard for the smaller defects, and even for larger defects where you're trying to get good marrow access without damaging the subchondral bone. I also will probably use it in cases where I'm going to be using a biological adjunct for those larger defects, where you have some sort of scaffold, but you want to still get good marrow access in order to get the cells to that area to help that heal.
Well, that's outstanding. Thanks so much for your time today, Dr. Coe.
You're welcome, Joseph. Thank you.